Most people know what they are, at least on one level. Obviously, these have been widely used medications. They are given as pain relievers, but of course, they can also be highly addictive. Are there other opioid receptors? Are these two things sort of are they two sides of the same coin, or can you
Right,
separate
right.
the
Yeah.
addictive and the pain relieving parts of this?
Great question. So, the first studies that really demonstrated that there were sites in the brain that were binding opioids, such as morphine, fentanyl, oxycodone, all these things sort of work the same way, suggested that there are specific proteins that neurons express that can bind these drugs. And so it's really the discovery of the genes that sort of clarified what the endogenous opioid system is. So our body expresses a number of receptors and a number of peptides that are part of what we call the endogenous opioid system. So this is a system, people don't always fully realize this, but essentially what these very dangerous drugs do is to hijack our endogenous opioid system. But normally in our body, even when things function perfectly well, our cells can release some endogenous opioids that are known as endorphins or enkephalins that produce effects that are useful for us, that are not dangerous. And they do that by acting on these receptors that are known as opioid receptors, and they come in several flavors. Three main receptors that are known as mu, delta, and kappa, opioid receptors. And so at the time when people, and so this has been a long problem, right? People often ask me, how come we still have to deal with opioid addiction? This has been known for so long. Why is it so difficult? And so at this time, so you have different receptors that can potentially bind opioids such as morphine. And so there was the possibility that one of the receptors was responsible for the positive effects, the analgesia that we still need in the clinic.
Mm-hmm.
And maybe one of the other types was the bad one, right?
Yeah, yeah.
Important for
Which would be
addiction,
convenient.
right.
Yeah.
So then if that was true, then what you need to do is to have chemists doing their work to generate novel compounds that are what we call more selective, that will preferentially activate the nice receptors and not those that are causing the side effects. Unfortunately, so the work that Brigitte Kiefer, my PhD mentor, did demonstrate that that's not the case. The respiratory depression, so one of the reasons why opioids are so dangerous is that not only they are addictive, so many drugs or habits are potentially addictive, but opioids have this particular property that they have receptors in the brainstem, in the respiratory centers. And so most people who die by opioid overdose die by respiratory failure because opioids directly inhibit respiration. And since they're also like sedative, people can fall asleep and essentially stop breathing in their sleep. So that's quite different if you think about cocaine, for example, or psychostimulants. They get you excited. So and they don't have this effect on the respiratory system. So you can still die from overdose, but it's much less common than with opioids.
I see. So they're sedative and they can depress the respiratory system. So
Right.
the fact
So
that you
that's
get those
very
two
dangerous.
things, yeah, those two things simultaneously, you just fall asleep.
Right, exactly. And so so what Brigitte did at the time, she had just cloned the genes that encode the different opioid receptors. And so she made knockout mice, so mice that are completely normal, except that they don't express one of the opioid receptors. So you can think about this as three different strains of mice that lack either mu, delta, or kappa opioid receptors. And it turns out that if you give an opioid, whether it's morphine, oxycodone, fentanyl, to the mu opioid receptor knockout mouse, this mouse is essentially immune. Nothing happens. You don't have pain relief, but you don't have addiction, you don't have respiratory depression, you don't have constipation, nausea, vomiting. All the side effects of opioids are gone. So that's a much bigger problem, right? Because instead of having to work with chemists to make better molecules, now you have the same receptor that generates both the positive and negative effects. So how are you going to tease that apart?